Thank you, everyone, for joining us today. And wherever you are, good morning, good afternoon, or good evening, watching this year's 2020 NYU Rory Myers College of Nursing State of the College Address. I am Eileen Sullivan Marks, and I have the distinct privilege to serve as the Dean of Myers. We do an update on our state of college. And this year, of course, we're doing it by Zoom and we are recording it. So later on, you can watch it at your leisure or share it with others. Of course, one of the things I want to say to all of you out there is I hope that you are well. I know that many have suffered. People have lost family members, friends. We've lost friends at Myers, alumni. And we also suffer from the fear of being alert for what might happen. And then we also celebrate, as we are today, that we are all coming together to address the pandemic in new ways. And I want to thank every one of you for being such wonderfully dedicated parts of our community so that we have been able to be not only presenting this to you today, but also that we can share with you the positive ways that we have grown and look ahead to the future. So in today's State of the College, we're looking at two parts. We're going to address COVID-19 response, looking back and forging ahead. And then also sharing with you our new 5-year strategic plan, 2020 to 2025, which we entitled Thinking Big, even before the pandemic. Big standing for belonging, innovation, and global. During our COVID-19 response, nurses became 2020 heroes. It just so happened that 2020 had been designated by the International Council of Nursing and others as the year of the nurse and nursing midwife. We've extended that, we've heard from ICN, through 2021. And indeed, we could say nurses can be celebrated for the decade. In that spirit, Myers innovated its way through the challenges. So let's start by looking back and then forging ahead. Here we are looking at the students as well as our staff. One of the things that we initiated right from the beginning was a task force. I actually looked back on my calendar to see when did we really start talking about COVID. And on my calendar, I had the first coronavirus meeting of some of my leadership on January 29th, 2020. And that happened to be the day after the World Health Organization declared the COVID-19 disease as a pandemic. So we started our conversations, and then we formed our task force at NYU Myers. And what we did with that task force was first assess our ability to move forward and how we would be learning online. We also needed to understand where our clinical partners might be as we anticipated and as we were dealing with New York City's increased cases. And what do we need to do for alternative student learning experiences? Communication plans are absolutely key, as we now know, in any emergency, and particularly in a pandemic. So we formed a communication plan. And we wanted to be able to find opportunities for teaching and research as we moved ahead in addressing. So here is our COVID-19 task force, chaired by Kim Glassman, who had just stepped into our newest Senior Associate Dean for Academic Programs, Academic Affairs, and key people from Myers in facilities management, administration, and we included students at the time, doctoral students, undergraduate students, graduate light green color, because we felt that this was an opportunity not only to hear from them as the crisis was unfolding in March, but also it's an opportunity for these future leaders to see how you address things in an emergency and how we work together and what is it you learn in real time. And looking back, our classes went online. In fact, all over NYU, nearly 40-some thousand classes moved to a remote capacity within a week and a half. At Myers, we had 81 courses that moved to remote learning. But it wasn't just moving them to remote learning at the graduate and undergraduate level. It was also how our instructional technologists, our information technologies came together to really move us forward quickly and be creative about the way that we were going to address remote learning. We also looked at our clinical sites in March last year and understood that at the pre-licensure level, students needed to pull out of those sites, as most did in New York City and around the nation. But we were able to facilitate our graduate nursing students in their clinical experience to move forward and be able, particularly for those who needed to graduate on time. And that was true for our undergraduates. So in the spring, for those who were ready to graduate in May, we were able to have them all meet the requirements that they could meet for that to happen. And I want to credit the relationship that we had with NYU Provost Office, as well as the state regulatory offices of New York State, which went very much forward in helping us be creative. And then our faculty did a number of things that really rose to the occasion very quickly. Dr. Mary Brennan, Natalie Paslinsky, and Leon Chen developed 5 online training modules about COVID-19 with their acute care nurse practitioner knowledge. And this came about because I was in conversation with Dr. Susan Orcega, Rear Admiral Susan Orcega of the United States Public Health Service Corps, and she is director of the Nursing Corps. And as they were ready to open up the field hospitals, as you remember, at the Javits Center and elsewhere around the nation, she contacted me to say, do you think that you have some teaching modules for my public health service nurses who may need to be in ICU type situations and don't have ICU training? And Mary Brennan and team came together and formed these modules that then were sent to the United States Public Health Service Corps. And I know that Rear Admiral Orcega has shouted out to us at recent meetings in which she's been speaking, and I appreciate that very much. Professor Tara Cortez was called upon to be a part of a committee for the National Institute of Allergy and Infectious Diseases to look at COVID-19 Prevention Network peer expert panel, in which they are going to look at the significance, impact, ethics, and recommendations for communities of older adults. And this work is ongoing, and Tara was appointed to that. We're very proud of that. During the spring, Professor Sandy Peo, who taught undergraduate nursing students in a leadership and management course, with her connections to New York City's health and hospital system, established telehealth opportunities for 230 of our nurses students to work with 20 faculty to provide phone and assistance to patients in their system, particularly pregnant women who had questions about their health and care, and also about COVID-19. And within a very short period of time, that was well underway and active. Jen Pettis, who is our program director of our niche program, Nurses Improving Healthcare for Elders, was involved with the state of Washington and several other states at the time, prior to the pandemic, about improving care in nursing homes, and actually had a grant from the state of Washington to address improving care in nursing homes. And one of those nursing homes was actually at the epicenter in King County, Washington. And we continue with that work today. Thank you, Jen. And here, looking back, our faculty and alumni. You know, so many of our alumni are involved in jumping into the care that we delivered in New York City at the last minute, and our faculty as well. Here they are presented. Ab Brody. You have to guess who they are because of their PPE. Ab Brody, Leanne Chen, Gina Roberto Yelli, Jennifer Nahum, Brian Pasulko. So thank you for all of your work in moving that forward and addressing the needs. And then, of course, we had the opportunity, it's hard to recall now that we had such a crisis with the ability to have protective equipment. And we, of course, had to shut down our clinical simulation center for a while, but we had lots of PPE. And we immediately boxed that up, as you see on the left, and sent it to NYU Langone Health so that that was part of contributions that we made. In addition, through a responsive and resilient health system project that we had ongoing in Liberia, we had supplies that were donated and delivered to Prevention Hospital in Liberia, including 1,500 bottles of hand soap for hand washing, hand sanitizers, 300 gowns, and over 500 face masks. And of course, we had faculty who were very much engaged in the media. I want to thank Rachel Harrison and Keith Olson in my communications team. As I mentioned, it's important to have a communication plan, who immediately were able to make contacts. And this is my appearance on MSNBC very early. It was just at the time when Americans were told to return from Europe. And I was responding on TV to the crowds in the airports when they returned, and how quarantining and distancing was going to be so important moving forward at that time. And that led to other appearances that were so important at that time to be able to talk about basic public health guidelines. And our faculty were able to step up as well. And I want to highlight some of these important things. Maya Clark-Pataya answered questions about how to help Black Americans fight the virus. She's an expert in acute care and an expert in how chronic illness affects Black Americans and Black people in different ways. Tina Satarangani was on the New York Daily News to talk about how to help seniors now through the coronavirus social distancing and how that increases stresses in their lives. Eloise Cathcart spoke to the Becker's Hospital Review, saying behind every nurse is a nurse manager, and 4 tips for those leaders in the pandemic. Sally Cohen spoke to Health Day US News and World Report about cyberbullying, how it could rise during the lockdown and what parents can do to stop it. Donna Hallis spoke to New York Magazine why reopening New York City public schools have been so complicated. And Sean Karp spoke to Cranes New York about nurse staffing, how that takes on a new urgency in the pandemic. And with Zoom technologies, one of the things that became really important was the fact that we could reach out to alumni in new ways and have our faculty expand on the kind of things that we were already doing in the classroom and engage with our alumni. And we hosted 20 events, increased the number of first-time attendees, and reached out to donors during that time, which increased community among Myers and NYU alumni. And the kind of topics, of course, that were covered were COVID-19 related panels of people on the front lines talking about their experience, about how lessons can be learned from the global South and how news from the front line really engaged our alumni. And Professor Cathcart spoke about wine and unwind, meaning we have to pay attention in crisis to our own health holistically, not just physically resting, but resting our mind and spirit. And then we had the response within the NYU College of Nursing itself. And these are the wonderful system workers that came together to really support the academic changes, the research that was needed to be ongoing. And I give a shout out to our HR department led by Susan Littman, to communications led by Keith Olson, operations led by Lance Irving and Ellen Lyons, IT with David Resto, and finance, Ellen and Jamie Chapelle. So these people responded just like we saw the heroes on the front line to keep us going. So with COVID-19 looking ahead, what is it that we needed to do next? Well, we needed a strategic action to really understand how we would move ahead. So once we were out of the crisis, in the sense of really trying to catch up and calm down and have a plan by late spring, we connected with the provost office around the university to do a restart steering committee so that we really understood how we needed to move forward with plans. Our 3S approach to what we were going to do with classes in the summer and into the fall. And when we said 3S, it was the idea that we would not have large in-person lectures any longer, but we would have seminars, perhaps. We would have simulation, and we would have service. So it really was approaching what is it that we can do in that framework to move ahead. And it's been very important to have these individuals as part of our restart committee, which we have put in place and will stay with us through at least the end of this semester into next. This doesn't take over the functioning of the school, but is really a communication steering committee where information can come into a central place, be understood and vetted to the right people, and come out again, so that our operations continue under the faculty council, the faculty council steering committee, the Dean's leadership team, the Dean's leadership coordinating council, the management teams. But this committee is a body that facilitates working together and is comprised of lead staff, managers, faculty, and administration. Looking at our building, one of the things that we had to do was decrease de-densify the square footage and how we would use it. So of course we can't use the lecture halls, which hold 130 people, for more than a few persons. So what we really aimed to do was focus on the simulation center and the learning commons, which have reopened in a de-densified way. And we've been very smart about safety. And we've been focusing not only on how we can help others who will be coming into the building to stay safe while they're there, keeping distance, staying home if you don't feel well, washing hands, avoiding touching your eyes, all the things that we now know are part of everyday life that we all do, wearing a mask. And here you see the signage that has gone up throughout NYU and in our building, so that when people come into the building now, and a few have, but students are back, as you'll see, these are the signs that they see with not only reminders, but also what to do. So there's one stairwell that goes up and one that comes down, only two people in an elevator. There's divisions for lanes, how to walk in particular directions, and it all works very well. If you need a mask, if you forgot it that day, we have public health ambassadors in the lobby who are student volunteers from around NYU, not only to provide masks if needed, but also to help individuals with questions. So here we are. By the fall, we had our Myers students back at 433 First Avenue in clinical simulation learning. And that's been very important because the clinical simulation hours count for the clinical hours that the students need. And the state has granted us approval for that. One of the things that the faculty did in the undergraduate program under the leadership of Dr. Larry Slater was look at the summer as an opportunity to move ahead with remote learning in lecture didactic content so that when we opened in the fall, we could focus fully on extra time to do the clinical hours. So rather than students in the fall being in lectures 2 days and clinical 2 days, in the fall they were in clinical 4 days at times and still are. And meanwhile, they're in the clinical simulation lab. And here they are joining in their clinical experiences. And when I returned to the building a few days a week in the fall, in September, and could see the students, I can tell you the happiness on their face as I ran into them either inside or outside of the building were very much ecstatic, happy, and grateful for everything that everyone did to have them continue with their learning. And here you see some of their pictures. And I want to share this video with you. And now from Dean Robert Grossman at the NYU Langone Health, who's also the CEO.
Hi, guys. I'm honored to speak at this year's event, and I'm grateful for this opportunity to congratulate you on your choice of such an important and vital profession. Nurses are rightfully revered for their caring, compassion, qualities that have been on vivid display since the pandemic first struck. But I think COVID-19 has brought another quality to the forefront as well: courage. From the earliest corona cases, nurses have been on the front lines, overcoming fears for their own safety to serve patients and aid their colleagues. In many instances, their generosity of spirit provided the only solace for patients dying alone. At NYU Langone, I witnessed nurses from every corner of the institution stepping forward, including those who retrained quickly so they could be redeployed to units that care for acutely or critically ill patients. I'd also like to share with you a short clip that highlights some of those who worked so tirelessly during that time. COVID-19 has inflicted almost unfathomable suffering. It has taught us, or at least reminded us, what heroism really means and who the real heroes of our country are. I've always believed that a crisis brings out the best in us. Often it reveals strengths we didn't even know were there. And I think the depths of selflessness, bravery, and resilience your community has exhibited since the onset of COVID-19 may have surpassed the expectations of your most ardent admirers and may have even surprised the nurses themselves. I salute you for your commitment to such a noble calling and wish you the unique sense of purpose and meaning that comes from a life of service. Thank you and congratulations.
Well, thank you, Dean Grossman. Very inspiring, and I wanted to share those words of encouragement, inspiration, and gratitude with you. I know that they have been shared as well with NYU trustees, and Chair of the Trustees, Bill Berkeley, has also sent remarks to me in the College of Nursing, thanking us for everything that we've done at NYU as well. So now, let's talk about thinking big, belonging, innovation, and global, and talk about the challenges that we have ahead and what we've done. So, thinking big, here we are at our virtual staff retreat to look at our new 5-year strategic plan. Here we have 136 of us who are on a virtual retreat that was enjoyed by everyone. And it was at a time when people were glad to see one another again. And it was about 65% of the whole community of staff, administrators, faculty. We've come up with a new mission. And in this new mission, we built on the mission that we already had. But what we did, because we felt that it was time to really focus on what had been core values and put those core values into the narrative of the mission. And those core values had to do with community, diversity, inclusivity, and belonging. So our mission at NYU Rory Myers College of Nursing, we are committed to creating an inclusive community, bringing a diversity of perspectives to our work, and promoting equity of opportunity and engaging in scholarship and education to build a more just society. And we, through our, we're missing a line here, through nursing, health, and interdisciplinary science, we educate leaders in nursing to advance healthcare locally and globally. We provide innovative and exemplary healthcare, and we shape the future of nursing through leadership in healthcare policy. And we have 4 new Thinking Big goals. Fostering a culture of inclusive and diverse voices so we connect to the larger work of the college. We prepare innovative nurse leaders for the health needs of individuals and populations. Now, just not families and individuals, but whole populations that have been brought to the fore in the pandemic. That we are a leader in scholarship and research. You'll hear more about our beginning success in this to really grow rapidly, and enrich graduates with global and local content of nursing and healthcare that we call Global. So let's talk about the B, belonging. Here's a number of new hires that we were able to make during the last fiscal year, and it includes people who, about 1/3, who have been hired because of new grants, new projects, and new research, in addition to some which are replacements and others are replacements and others are new growth opportunities. And I think it's really important to recognize the diversity of these titles and how all of this work comes together to build a wonderful community. And here we have new faculty hires for this year. Mairead Gormley, an assistant professor. Belda Gonzalez Mercado, an assistant professor. Ida Azcara San, clinical assistant professor. Jasmine Travers, assistant professor. Dina Schulman Green, associate professor. Yewang Zhang, assistant professor. And Mimi Niles, an assistant professor. I think you can tell from these photos that this is a new generation, an excited generation who've already made a mark as they've arrived to us virtually. And I'm grateful to them because these folks were recruited at a time when we were in person for a while and then all of a sudden not in person. And some relocated or decided to stay where they are and come into us from a Zoom perspective. So thank you to all of you for joining Myers. And it's wonderful to have you as part of that community. Our faculty and staff diversity is something that remains a challenge for us. 41% of our faculty identify from underrepresented nursing groups. We can grow that to match our students a bit more. And more than half of our staff identify as underrepresented groups. We've also been able to have faculty promotions. Faculty promotes this year have the word clinical in them. This has been a long time goal for us and something that was important for me to look at when I became dean in 2012. As you recall, at that time, we were just forming some new faculty council. We became an independent College of Nursing at the time. And we needed to clarify how our clinical faculty develop opportunities to move forward. And we've been doing that. In academics, that sometimes can be quite a tedious process, but we work together as a whole, faculty, HR, our resources in the university to come up with criteria that fits with the full university so that this year we saw the biggest opportunity for people to move to the next level in title. And I know we're going to be having more come through. And this has been a long interest of mine. One of the things that has been so very important is recognizing our faculty achievements. I could do an entire hour presentation on all the achievements that our faculty have had. It's just a remarkable and a work of pride for me to be able to talk about all the things our faculty have done. We have 7 new fellows this year, either in the New York Academy of Medicine or the American Academy of Nursing. And we have a total of 4 teaching awards. I want to highlight that Dorothy Houlihan, who you saw had been promoted to clinical professor, also was one of the 5 NYU distinguished teachers this past year. Carolyn Dorson got the NYU Myers Distinguished Teaching Award. Dr. Chen received the Robbins Family Award for teaching. And Dr. Larry Slater received the New York Nursing Education Award from ANA New York. So just a highlight of how important teaching is. And we've had others that I want to talk about in terms of national expert panels or review panels. You heard me mention Tara Cortez, who's on an NIH COVID-19 prevention committee. Dr. Bei Wu was a reviewer for the 2000 Surgeon General's report on oral health in America that recently came out. And Dr. Tina Satarangani has been part of the National Center for Complex Health and Social Needs. It's important also to note some other national recognitions. Dr. Selena Gillis was celebrated as the Nurse of the Year Award by the National Black Nurses Association. Dr. Beth Latimer was recognized for International Nursing Association as a leader for clinical simulation. And Erin Hartnett received, with her work with Dr. Judy Haber, the American Academy of Nursing's Edge Runner Award for their work on TOSH, teaching oral systemic health, and the work that they've done, which has changed our view, as they say, putting the mouth back in the body. Their work has been recognized. Judy's work in that area has been recognized by NYU's Alumni Association as a Changemaker Award. And she appears in the most recent issue of the NYU Alumni Magazine. I think it's also important to recognize that books that our faculty write are recognized and attended to. Dr. Hallis has had a Book of the Year award from the American Journal of Nursing, and Candace Knight has a case study approach to psychotherapy for advanced practice psychiatric nursing. These are all important ways to disseminate our work, in addition to the fact that we are on editorial boards. Dr. Wu was added to the prestigious journal Aging and Health Research this year, and Dr. Lim was recognized in an advisory group for LGBTQ plus health inclusion in Ireland and the United Kingdom. So I haven't covered everyone. I urge you to look on our websites to read about our faculty and our faculty accomplishments, but I wanted to give you a rich sense of the impact that our faculty have on healthcare. And our administrator and staff have received promotions this year as well. Yanni Walker became the Associate Director of Advising. Lance Irving, a well-deserved promotion, Director of Administrative Operations and Facilities Management. Lance has been on one of the major steering committees for the university COVID-19 response this year, and has been integral to how we've been able to move our building back online this fall. Jennifer Pettis, as I mentioned, is Director of the Niche Programs. I'll talk a little bit later about Dr. Tanisha Johnson Campbell and her work as an assistant dean in advising academic administration and belonging. Nick Heller in HR became a manager. Christy Durr became an associate director of graduate programs, and Kimberly Hom, a project officer. So congratulations to all of you. And here's some awards that we give internally this year. Our Outstanding Staff Award went to Tamara Toby, who is in the building with me a few days a week, doing her work in facilities management. An outstanding administrator, Hank Sherwood, who put together the slides for today. So all these beautiful graphics, you can give Hank an applause. And our Promise Award, meaning that someone who really holds and exemplifies the promise that nurses in the college give to others, Yanni Walker. Congratulations to all of you again. And the Daisy Foundation Award, we usually give to a faculty and a student. So this year, Dr. Fidelindo Lim received the Clinical Associate Professor, and Brittany Tam, who graduated in 20, received a Student Award from the Daisy Foundation. Dr. Tanisha Johnson Campbell this year became the Assistant Dean for Advising Academic Administration and Belonging. And she's chairing our new Inclusivity, Diversity, Belonging, and Equity Steering Committee. We had a diversity committee for a number of years that Tanisha was involved with, chaired by Jim Pace, who moved on to be dean at Valdosta University this past year, giving Tanisha the opportunity to chair a new committee that we wanted to formalize and embed in our administrative structure so that all the work on inclusivity, diversity, belonging, and equity could be woven throughout the tapestry that is the College of Nursing. We still will have a very robust diversity volunteer committee that is organic and dynamic, but we also needed a formalized structure that also connects to the larger world and to NYU's Office of Global Inclusion. And Tanisha has been very active in that area. So congratulations, Tanisha. And with that, I also expanded my Dean's leadership team to include Tanisha Johnson Campbell in this role as part of my leadership team, and as well Keith Olson, our Director of Communications, joined the Dean's leadership team this year. And I want to welcome Dr. Deborah Albert, who's the new Chief Nursing Officer at NYU Langone Health, who came to us from University of Chicago Health System. Prior to that, she was in Cleveland Clinic System. She's very excited, she tells us, to be here, to be at a place that is a large enterprise, health enterprise, that it has a School of Nursing in partnership. She hasn't had that for a while, and she's very much looking forward and has been very much engaged with us. And I congratulate her not only on this appointment, but arriving in New York City in April in the spring. And we just recently held a virtual reception for her and welcomed her, and it was very exciting. And Dr. Kim Glassman, who formerly had the role of Chief Nurse Exec at NYU Langone, joined us in January as a Senior Associate Dean for Academic Affairs, replacing Dr. James Pace, who I mentioned moved on to become a dean. And what wonderful time did I have to have Kim in this role as the pandemic hit, so that we could really move forward fast with clinical partnerships. And she chaired our COVID-19 initial response committee. So thank you, Kim. And it's wonderful to have you fully in our academic world. So let's talk about innovation. And in innovation, of course, has been a very important part of what we have been doing and want to move forward. One of the examples of recent innovation during the pandemic is in our Clinical Simulation Learning Center. We launched EPIC. Now, EPIC is one of those things you probably have heard about, that is electronic health record system used in many different health systems. The interesting story to me here is that the idea of bringing the real learning system, the health network, into our clinical learning system started during Hurricane Sandy, when we knew that we would have this opportunity. So during Superstorm Sandy, EPIC was introduced to NYU Langone during the time when they were less than full operational. And at that time, Kim Glassman said, I want to be able to get EPIC into your clinical simulation center, which we were only building at the time. So the innovative idea of doing this started with Sandy and was put into fruition as we during COVID-19. So here we have the students showing that we now have the same EPIC training system, so that students can learn how to document assessments, document patient response, document medications that they learn in the Clinical Simulation Center, and then can use when they set foot into the health system. And we launched in this last year and a half the Myers Biological Lab at 433 First Avenue. This was something that I talked about as I was in interviews to be dean at NYU. Any top School of Nursing in research in the top 10 must have its own lab, so that we can have our faculty who conduct research have access to samples, DNA samples, others, so that we can move forward. And so this innovation has really sparked our growth. And here's a fabulous good news story. So as we went remote in March, Dr. Gail Melkus, our Vice Dean for Research, and Dr. Vicki Dixon, who is Director of our Quest Research Center, really led the team of not only faculty but administrators under the direction of William McCormick to increase the number of submissions for grants in research. We had a 30% increase in grants during the pandemic. And I want to give a shout out and thanks to the Vice Provost for Research, Stacy Grossman Bloom, who so helped us with making sure that we could facilitate this moving forward. This has resulted in, right now, we know more than 20% has been funded. Another 50% of these grants are pending, 30% weren't. But this represents that we're still waiting on another $13 million in research that has the potential for funding. And that is terrific. So congratulations to you all. Here is also some NYU internal funded grants. There was a challenge grant put out by NYU for research in COVID-19 areas. There were 90 submissions, only I think less than 10 funded, and our faculty, Professor Amy Laskowski-Stimple was one of the 9 awardees for that internal grant. We had Teresa Bucco and Beth Latimer on our faculty receive curricular challenge grants, as well as Stacy Keating and Robin Clark in this last year. So some examples of some recent NIH research awards gives you a sense of the breadth of the work of what our faculty do in our areas, mostly looking at chronic health, aging, oral health. And I think it's so important to recognize that these awards are being awarded to both beginning career people and assistant professors, as well as senior people. And I think it really speaks to the success of the attention that we've put to innovation and research. And here you see in 2020 our government funding amounts and government source amounts, not only coming from the National Institute of Health, but others like the Center, CDC, or Disease Control, Health Resources and Service Administration, and HRSA. And it really will keep us in the top 10 of rankings for schools of nursing with research awards and funding awards from the NIH. And particularly, I think when at the close of 2020, we will probably move up in ranking from number 8 to up toward 654. So that's very exciting. The funding resource capacity per faculty member is also very robust. These are excellent numbers. That the average grant funding for a tenured faculty member is $275,000. That is one of the highest on average for faculty in schools at NYU. And I think it's very important to understand that they also get non-federal grant money to support their work. Our budget, of course, doesn't change a great deal as schools of nursing because our revenue sources are pretty much net tuition and fees. We have some grant revenue, of course, that comes in for indirect funding, and we have gifts and pledges and endowment contributions, and our niche program brings in a source of funding. And it's important to understand that we have not seen a drop in this and won't predict a drop in our net tuition and fees because our enrollment remains strong and robust during the pandemic. What we need to do to consolidate our budget expenses for the whole university at this time, like many other universities are watching our belt, if you will, is really focus on other than personnel services, OTPS, which means let's hold off on capital projects, investment projects, other things that don't involve personnel. We do have a hiring freeze. We have been able to move forward with hiring faculty, as you saw, because they are replacement for important and critical missions. But we also have held flat on the amount of increases in salary as the whole university has done moving forward, and this will continue for the rest of this fiscal year. As you see here, our enrollment has been moving up, and this is a good sign. So our target enrollment is that a bright purple line. And we have a larger enrollment above that for a number of years. We did a bit of over enrollment last year because we had more transfers than we expected. And I think that just speaks to the fact that nursing is a career that people want to join. And Myers is a place, and NYU is a place where they want to go. So these numbers are strong and continuing. And these numbers show targets that we wanted to achieve. We see that for our baccalaureate program in fall 2020, we had 3,600 applicants. And out of that, we admitted 20%. And of those ones that we admitted, we enrolled about 45%. That number, 45%, means that we only have a certain number we can let in. We only have the ability to have certain arrangements for a number of faculty and the capacity and clinical experiences. Our MS and our DNP programs remain strong for the numbers that we target. Our PhD program, we held a little more closely this year, enrolling a few less because we also want to be able to have the funds to support our current doctoral PhD students. That was true throughout the university at the direction of the provost. But moving forward, we will be able to be robust in our enrollment of PhD students. This gives you an example of our entering first-year students and where they fit on diversity and inclusivity. The purple is ours, and gray, of course, are national figures that we benchmark against. And we remain very strong in having a minority white and more diverse population. Our African American numbers are slightly below national average, and we know that we need to do more in that area. They're similar to the numbers for African American enrollment throughout NYU itself. We're not sure what that means, but I just note that it's pretty consistent. One of the things, of course, with our steering committee now really focused on inclusivity, diversity, belonging, and equity is that we can reach out and be more robust in how we address that issue. Plus, we are in process. We have a verbal agreement to have a partnership with Howard University School of Nursing and Health Sciences. Dean Gina Brown has worked with one of our faculty, Audrey Linden, in her work in research, and they came up with a proposal that we now have a draft memorandum of understanding to work with Howard University, the historic Black college, for all sorts of education, research, and service opportunities so that we can have perhaps student faculty exchanges. So we're very much looking forward to that partnership. And here are some numbers to point out on our traditional first-year undergrad admissions. Don't worry about that number, less than 7% from last year, because last year, as I mentioned, we had an exponential increase in transfers. So we brought that down a little bit to get to our capacity for what we can manage. But these are very important numbers to look at for the traditional first years. You saw the larger number for the number of applications that include our accelerated students. So these are very strong numbers, and thanks to Dean Amy Knowles and her student enrollment and admissions team who worked so hard with the university for these numbers. And every year, our Myers Scholars, thanks to the gift, naming gift from Howard and Rory Myers, we are adding 3 to 4 new students every year. Rachel and Gavin will graduate this spring 21, and so we're very excited to be celebrating them, and we're really pleased with that. And here, I'm thrilled to announce another changing gift from Rory and Howie Myers Family Foundation, a $7 million gift for 5 years worth of scholarships to support an innovative model of interprofessional education for third-year nursing students to learn and work with medical students and other health professionals in their clinical year at NYU Langone Health Winthrop's Hospital. And that's in partnership there with the new NYU Langone Health Long Island School of Medicine located in Mineola. This is a community hospital that is part of the NYU Langone Health. Steve Shellock at that School of Medicine and I are very excited about opportunities for our students to learn together, and that the students from Myers who will be there in their third year will have full tuition and room and board covered for their third year in this process, and that will start fall 21. So again, thank you to Howard and Rory and your family for this, and I'll pause for cheering and applause from all of you. Going on to global. So global, of course, we are global. We are living a coronavirus that sees no bounds and sees nothing that is the same. Here are our Shanghai, our New York, and our Abu Dhabi 3 sites that we had planned to be more robustly engaged with in person, but we remain active in the global community, albeit remotely. We've been renewed for our WHO Collaborating Center for Nursing Education, directed now by Professor Nancy Van Devanter. These are centers that work together across the Caribbean, South American region. That is our assigned center in Pajo, where we work on education efforts in aging with partners. And we have Dr. Robin Clark is the principal investigator for programs in Rwanda and Liberia that have been ongoing for a while. And part of that work she has expanded to Ghana, funded previously by Banco Santander, Fundación Mujeres for Africa. The Rwanda project, which is funded by the Rwanda Ministry of Health, was recently funded for its 8th year, and we joined other nursing schools and medical schools in that project. The Liberia project is we work with Harvard School of Medicine on a HRSA grant and are the only nursing college involved in that work. So thank you, Robin, for that continued work. And Professor Bei Wu, who serves as the Director of Global Aging and the Director of Research for our Hartford Center in Geriatric Nursing, has been focusing on older adult care in China and Norway, and that continues to be engaged with in Shanghai, NYU Shanghai, and around the globe in projects related to the importance of social science and older adults. And we have our Memorandum of Understandings with the School of Nursing Fudan University, which is in Shanghai. We have Memorandum of Understanding with University of Hong Kong, with the National Cancer Hospital in Dominican Republic through our WHO Collaborating Center, the Ministry of Health in Liberia, the Mother Pattern College of Health Sciences in Liberia, with the Erasmus Plus European work for introducing nurse practitioners in Lithuania, and the University of Oviedo in Spain. So that's our talk today on the state of the college. Looking back, moving forward, thinking big. And as a profession, nurses heal through science, evidence, and compassion. And I thank you today for joining me in the state of the college. And I want to particularly thank Tom Friedman, Ellen Lyons, and Hank Sherwood for this beautiful work and the beautiful slides that we've had today. Ian Headley and Dave Resto for all of the IT support in bringing this to you today. Thank you for attending. I know that we have a Zoom going on, We're at our hour, but I'm happy to take any questions if I see them in the chat. So I'm going to stop sharing my screen and take a look at you all. So let me look in the chat and see what I see. Lots of congratulations, lots of good news. We look forward to hearing from you and ongoing opportunities to really understand the work that we do, to participate in alumni events, participate in other events. And you can put your questions into the Q&A section on your lower bar, I believe. It's usually the lower bar. Here they come. So someone says they're looking forward to another productive year. So am I. And let's hope that by the end of 21, it won't be a Zoom and we might be able to be in person. There's good hope to think that that's where we'll be. Thank you again to Howard and Rory Miners for your wonderful new gift. I know that it's just going to launch our strategic plan in wonderful and new ways. Thank you, everyone, for being with us today.